Shalom, we're here with Shaul today, who suffers from multiple sclerosis and who's been suffering from one of the worst pains known to man, which is trigeminal neuralgia, for many years now. Shaul, how many years ago did you start having trigeminal neuralgia?
About over 4 years, about 4 years.
And how would you describe the pain that you have from the trigeminal neuralgia?
Nothing to describe. Terrible pain.
Would you agree with some people who say that is one of the worst pains known to man?
Probably. I don't know all the pains, but for me it was the worst.
What did it feel like when you had the pain?
It feels like if somebody have a hole in his teeth and he go with something inside to take and he touch the nerve, the same pain.
And it was a pain that lasted a long time?
It lasts perhaps half a minute. It then goes away, but then it comes back again.
Every how long?
Every 3-4 minutes.
So it was like having a dental treatment every 3-4 minutes.
Exactly.
Day and night.
Yeah.
It would bother your sleep as well?
Oh, I couldn't sleep. Not me and not my wife and not nobody at home because I was screaming.
And then you started treatment with Tegretol.
Yes.
Now what I understand is that Tegretol was actually quite effective at reducing your pain.
It did.
But you had some problematic side effects. Can you tell us a little bit about those side effects that you were suffering from?
On the beginning I didn't take a big dose a day, but it started affecting me on my balance. I start walking badly, and as more I took, daily, when I took 700, 800, I couldn't walk at all. Even from the living room to the bed, my wife had to take me.
So what I recall is that at the beginning you didn't require that much Tegretol, but
no, slowly,
as the months evolved, you required more and more, and then you reached the dose of 800 milligrams.
Exactly.
And what you just told us is that when you were at the dose of 800 milligrams, which you had to take for more than a year prior to meeting me, you were not able to even walk from the living room to the bedroom because of the terrible side effects.
Exactly.
Because you have multiple sclerosis, of course, you were more susceptible to these side effects. And you were on the 800 milligrams of Tegretol that was causing all of these problems for about a year. I understand that you also had to stop driving because of the side effects of Tegretol.
I could go, I couldn't drive, I couldn't walk. I could just sit at home.
And then we met because you were trying to find solutions that caused less problems, but that maintained you pain-free with your trigeminal neuralgia. And we introduced you to the PainShield device, which is a low-intensity, low-frequency ultrasound device. Now, where would you put the patch when you were using the PainShield device?
On
the area of pain. Yeah. And this was a patch that you would basically go to sleep with.
Yes.
And you would use it for 8 hours overnight while you were sleeping.
Sleep. And during the day I put it for another 2, on the beginning, another 2-3 hours.
And explain to us how this went in the first weeks. What happened? What did you see as an effect of the PainShield?
I didn't see nothing, but slowly I reduced the Tegretol and no pain, and it was excellent.
And within a month you were able to...
Hardly for nothing. I could walk again, I could do anything.
So once we got rid of the Tegretol, your walking improved, and you were able also, I think, to return to driving.
Yes. I returned to drive and everything.
And all this without any trigeminal neuralgia pain.
Exactly. But this was for 6 weeks.
Which is terrific.
After 6 weeks, the pain started to...
And then what did we do to fix that?
No, on the beginning, I took the...
If you recall, we gave you some topical ketamine.
Yes.
Right?
Yeah.
So this is a cream that basically has no side effects.
Yeah.
And that combined with the ultrasound that drives it into the flesh and nerves was giving you what you needed. And from what I understand today, we're now 5 months after the initiation of the treatment with PainShield, and 3 months after the initiation of treatment with combined PainShield and topical ketamine. And today, you're in a pain-free state with an 80% dose reduction in Tegretol, which is that you're now taking just 200 milligrams of Tegretol daily, whereas in the past you had to be taking 800.
Exactly.
And this has allowed you to have less side effects. Your walking has improved and your driving has improved.
Yeah.
We hope that in the future we will be able to eliminate the Tegretol completely. These things, however, may take time. But together we'll accompany you through the process. I thank you for taking the time today, Shalom.
You're welcome. Thank you.